Hello, everybody. My name is Giulia, and I'm a member of the board of directors of the International Federation for Spina Bifida. And I'm also cooperating with the Italian National Association for Spina Bifida, ASBI, which is based in Emilia-Romagna. The idea of this video is to briefly share the Italian situation now and how ASBI is coping with the coronavirus emergency and what we are doing to carry on with our internal activities. So now in Italy, we have around 100,000 people affected by the virus, with more cases concentrated in the north regions, even if the numbers in the south regions are increasing too. The confinement measures started from the 8th of March, and from that date onwards, the Italian government has gradually forced the closure of businesses and personal services of all type in all the national territory, with the approval of a series of decrees. And due to these decisions, also ASBI has been obliged to cancel a series of activities, such as our annual summer camp, which usually takes place in July, and also other weekends for independent living directed to planned to young people with disability. And also we won't be able to organize our annual conference for people with spina bifida and their families. So ASBI is obviously trying to find alternative ways, alternative solutions in order to continue offering the usual services to people with disability, with spina bifida and their families. And actually, the good thing is that technology is really helping us in doing this in order to communicate with our members and to keep in touch with them. But we are thinking of a digital conversion of more activities, for example, using Zoom or Meeting as platforms in order to organize webinars. Since the beginning of this emergency, we added a section in our website which we collected a series of information related to the coronavirus, like ministerial decrees, several vademecum, but also specific information to disability. And so if you want to have a look, you will see the link appearing below. Actually, we didn't expect this emergency lasting for so long. So at the very beginning, we thought a simple way to involve children that were home from school. So we asked them to draw something and to share the drawings with us so we can publish them in our Facebook page or website. But then we realized that this situation is getting worse, and so we activated our remote listening space. In cooperation with ASBI Niguarda and some psychologists and psychotherapists, so that psychological meeting could take place via Skype for people who were under therapy before the emergency, and also for people who need a psychological support. We also prepared a brief survey to gather information directly from people with spina bifida and their families on how they're living the situation, to understand their real needs and to understand if something has changed in these during these weeks, for example in the access of medical supplies or devices. We collected 90 answers, and we found that 30% of respondents are actually experiences changes for what concern the waiting time for receiving medical products or medical supplies. But also some other people reported issues related to the authorization of paid leaves, days off, or access to smart working from their employers. Then the Office for Policies in Favor of People with Disabilities sent a note to the regional health assessors saying that they needed to pay more attention on the needs of people with disability. So we decided to launch another brief online survey, this time related to the access, distribution, and delivery methods of medical devices, because we really need to understand this topic. And another activity we are supporting is a fundraising project set up by the National Federation of Orders for Nursing Professions, in favor of nurses that who every day are living the COVID-19 situation on the front line. So indeed, we know how much this situation is becoming dramatic and harder and harder for healthcare workers and their families, because we know that they are more exposed to the infection, and I also imagine that from a psychological point of view, it should not be easy. So ASBI fully recognizes the importance of these professionals in the supporting of disability. So this is the reason why we decided to take their side. So if you want to know more about this campaign, I leave you the link below. I also want to spend a last word about our regional associations, because in this period we think that their involvement is really important. So this is of particular importance for us because in Italy we have different levels of decisions about citizens' health. The national decisions that is in charge of the National Healthcare Service and the regional level. So that means that each region takes the decisions of citizens' health in its own territory, about its own territory. So, for example, during the past weeks, some Italian regions have communicated the extension of the validity of therapeutic plans for other 2 months in order to simplify the prescription of some medicines. And we as ASBI, as a national network, we need to collect this kind of information, and regional associations can support us in doing this in order to give a clear and complete information also to our members that are asking about this. In the next few days, we will also open the application to renew our youth group. And then we need to plan some other activities online. So from Italy, that's all. What to say? We know that this is a hard time, and we sometimes feel uncertain towards the future. Yes, it is complicated, a complicated moment, but it's important not to feel alone, because we are like a big family. We are glad to support you all trying to overcome this hard time. So feel free to contact us if you want to share your experience, if you want to share your troubles, or just talk to us. Or visit our website, or follow our social media to keep updated on our activities. And I wish that you and your beloved ones are well, and please keep safe. Bye.